My name is Dr. Homeopathy and let's talk today about cervical spondylosis. Cervical spondylosis is a degenerative condition of the cervical spine, which is the portion of the spine which runs through the neck. It is commonly caused by age-related changes to the spine, such as wearing down of the intervertebral disc and formation of bony growths on the vertebra called osteophytes. The symptoms can include neck pain, stiffness, headaches, numbness and tingling sensation of the arms. Causes. Cervical spondylosis is primarily caused by age-related changes in the cervical spine, including degeneration of the intervertebral disc and the formation of bony growths or osteophytes on the vertebra. The intervertebral disc, which acts as a cushion between the vertebra, can lose their elasticity and height over time, leading to increased stress on the vertebra and the formation of osteophytes. Other factors that increase the risk of developing cervical spondylosis may include 1. Genetics. Some people may have genetic predisposition for developing cervical spondylosis. Second, trauma or injury to the cervical spine. A previous injury to the neck of the increase the risk of developing cervical spondylosis. Number 3, occupational hazards. People who have jobs that involve repetitive motions or prolonged periods of time spent with the neck in a fixed position may be at a higher risk of developing cervical spondylosis. Other medical conditions, which include people with certain medical conditions such as rheumatoid arthritis, osteoarthritis, may be at an increased chance of developing cervical spondylosis. What are the exercises we can do? There are plenty of exercises which we can use to decrease the symptoms of cervical spondylosis. It is always best to consult with a physical therapist or a doctor before starting any exercise. The first exercise is neck stretches. Gently tilt your head to the left and then towards the right and then forward, holding each stretch for 15 to 30 seconds. The second is shoulder shrugs. Stand or sit with your shoulders relaxed. Slowly raise your shoulders towards your ears and release. Repeat this for 10 to 15 times. Third is head turns. Slowly turn your head towards the left and then towards the right, looking as far direction as possible without causing pain. Hold for 15 to 30 seconds. Next exercise is head tilt. Tilt your head to one side and hold for 15 to 30 seconds and then repeat on the other side. Next exercise we can think of is chin tucks. Sit or stand with your shoulders relaxed. Generally tuck your chin in towards your chest and hold for 15 to 30 seconds. The best exercise, however, are the isometric neck exercises. This can be done by placing your hand against your forehead and pushing back, or placing your hand on the back of the head and pushing forward. Aerobic exercises such as cycling or swimming can also help in improving overall fitness and reducing pain. It is always important to avoid exercise that cause pain or discomfort and to start with light exercises, gradually increasing the intensity over time. How can we prevent this? There are several steps that can be taken to prevent cervical spondylosis or slow its progression. These include, first, maintaining good posture. Sitting and standing with good posture can help to reduce the stress on the cervical spine and prevent the development of cervical spondylosis. Second is what we can do is stretching and exercise. Regular stretching and exercises that focus on the neck, shoulders can help to improve flexibility, strength and range of motion in the cervical spine and reduce risk of cervical spondylosis. Next point we can think is the ergonomics. Pay attention to your work environment and make adjustments to your workspace to reduce the stress of your neck and shoulders, such as by adjusting the height of your computer monitor or the chair. If you are maintaining posture, it is good for you. Next, what we can do is avoid smoking because it causes decrease in blood flow to the spine, which can increase the risk of developing cervical spondylosis. The next very important part which we can do is maintain a healthy weight. Obesity can put additional stress on cervical spine, which can increase the risk of developing cervical spondylosis. Avoiding repetitive motions or prolonged periods of time spent with the neck in a fixed position. This is especially important for the people who have jobs that involve repetitive motions or prolonged periods of time spent in the neck in a fixed position, such as office workers or assembly line workers. Get enough sleep and avoid high stress levels, as both can cause muscle tension in the neck and shoulders, contributing to cervical spondylosis. It is important to remember that cervical spondylosis is a degenerative condition that is caused by age-related changes in the cervical spine. So, it is not always possible to prevent it completely. However, taking steps to maintain healthy spine can help to slow its progression and reduce symptoms. Now we come to the homeopathic part of this video. See, during treatment of homeopathic spondylosis, it is very important to note that constitutional treatment can give the best results for all of the diseases, including cervical spondylosis. But however, there are several homeopathic remedies that may be used to treat cervical spondylosis depending on their individual symptom and overall health. Some of the most commonly used medicines include: number 1 is Rustox. This remedy is often used for symptoms of stiffness and pain and soreness in the neck after rest or in damp weather. Keynote being aggravation from rest or first motion and ameliorated by continuous motion. The second medicine which we can think about for treatment of cervical spondylosis is Bryonia. This remedy is often used for symptoms of severe pain in the neck and shoulders that are worse with any or slightest movement and are always better by rest. The third medicine which we can think of is Calcarea carbonica. This remedy is often used for symptoms of stiffness and weakness of the neck and shoulders. The pains are nocturnal in character. There is pain in between shoulder blades, impending breathing, worse after riding vehicles, as well as for people who have a tendency to catch cold easily. The next medicine which we can think of is Ledampal. This remedy is often used for symptoms of stiffness and pain in the neck and shoulders, painful stiffness from the loins to the occiput, which are mostly worse in the evening. The next medicine we can think of is Hypericum. This remedy is often used for symptoms of neck pain with shooting pains down the arms, numbness or tingling and sensitivity to touch. The next medicine is very important in cervical spondylosis is Simicifivir eccimosa. One of the leading remedies in muscular rheumatism, often helps in decreasing pain of spondylosis. The next medicine we can think of is Granitum. This remedy is excellent for vertigo with spondylosis, which is very persistent. The next medicine is very important for stiffness and it's called Lacnanthus. Where there is very much difficulty in turning to the neck to any side. Also a very good medicine for stiffness is Gettysburg water, which can be used in any kind of stiffness. One of the leading remedies again in cervical spondylosis is Scamia latifolia, where there is stiffness of the neck and sore touch to the neck, where the pain extends from the neck and to the fourth and little finger of the hand. Next medicine we can think of is Calcarea florica, where there is severe pain after a long ride, worse after a rest, better moving a little and with warmth. Development of osteophytes is seen in X-ray. Another very important remedy is Nux Vomi in this matter. Pulling pain in the neck with stiffness and rigidity, cervicobrachial neuralgia, neck stiff worse in the morning. It is to be understood that for the best results, a constitutional treatment is the way in homeopathy to treat any of the diseases. For that, a good case taking is required, taking in all points of the physical generals and also taking into consideration the psychological profile of the patient is very important to find out this constitutional medicine. With this, I would like to end this video and I thank you all for watching. Please do like, share and subscribe for more contents. Bye.